In recent months, a lot of attention has been given to faith-based initiatives, social programs that would be administered and delivered through religious organizations such as churches, temples, and mosques. But individuals from faith communities have always been actively involved in a variety of services to those in need. Join us now for a conversation about health care and faith on Austin Faith Dialogue.
Austin Faith Dialogue, at the crossroads of religion and life, a series highlighting the cultural and social interactions between the worshiping and religious communities in and around the capital city. Austin Faith Dialogue is brought to you by the Austin Metropolitan Ministries in cooperation with KXAN. Join us now in Austin Faith Dialogue.
Good morning, I'm Sarah Bentley. Welcome to this edition of Austin Faith Dialogue. Conversations about faith-based initiatives have focused on how religious organizations can deliver key social services in our communities. Such services might include emergency housing, assistance to families, substance abuse treatment programs, and other programs. At the same time, there are many people actively involved in service-oriented professions whose religious and spiritual ideals motivate and sustain their commitment. For these people, it is their chosen field of work that allows them to express their sense of compassion or their desire for justice. Today we have with us two people who have been active in the Austin healthcare community for a long time. Rosanna Zylak is the Executive Director of People's Community Clinic, an organization devoted to serving the working poor in Austin. Ramby Brinks is an internal medicine doctor with a specialty in gastroenterology, as well as expertise in psychiatry and gerontology. He is affiliated with the Scott and White Clinic in Round Rock. Welcome to you both.
Thank you. Glad to be here.
Let's begin by talking about how each of you became involved in healthcare. Rosanna, were you always in this field?
I was not always in this field. In fact, I had been involved in a range of work, some of it social work. At one point, I was an editor with SRA, which is a textbook firm in Chicago. And prior to coming to healthcare, I was a late-in-life law student.
Oh. I remember when we first met, you had just become the executive director of People's Community Clinic. Now, what was there about this organization that attracted you?
If I were to articulate it, it was a sense of everyone that worked there was held together by the notion that healthcare was a right and should not be a privilege, and the other guiding principle of the organization, which was housed in the Congregational Church, the basement of the church back then, that all patients must be treated with dignity and respect. And those two values of that organization, so clearly and consistently articulated, were things that drew me to People's Community Clinic.
Mm-hmm. Now, Ramby, you've been a doctor for quite some time. Can you remember what first drew you to the field of medicine?
I'm not certain I can remember that long. I have been on a steady path. I guess, like most people, when you really try to analyze where you got started, who knows. I knew I didn't want to be a farmer. It was too hot. So we went to medicine. But I had a lot of health problems as a child, and that probably exposed me to medicine in a very positive way. And then once you're on the roller coaster, you start out in pre-med, you don't have to think, you just end up a physician. I'm very glad of the decision I made.
Are there any settings or groups of people that you especially found meaningful to work with?
Now? Then?
Throughout your
Well, of course.
career.
And I have actually gone out of I guess, institutional medicine or organized medicine to find that. And I've mostly worked through my church and its outreach programs in terms of issues, policy issues related to health care, and many of the issues that are not being addressed by the healthcare system in this country now, and as far as long as I've practiced medicine, in fact.
One of the assumptions behind faith-based initiative is that important values, which you've brought up, Roseanne, could be best expressed or maybe transmitted through religious organizations. But what I hear you saying is that for each of you, your work allows you a vehicle or an arena for some of those values. And I think you spoke of a couple of those, Rosanna, in terms of the right of people to be treated with dignity. Are there others that you think of as your own personal, say, spiritual ideals or values that you find expression for in your work?
If I were to note one value that has been probably central ever since I was in college and took up a strenuous course of reading, it would be the notion that Martin Buber expressed in I and Thou. The sense of dynamic and active recognition of the other as a fellow human being. And it's that thou, not he or she or the object, but that sacred thou that that I find healthcare is an arena in which one can practice.
Rambi, what value or conviction would you choose as one that you've been glad to find expression for in your work?
Well, I think it's, and this is related to our faith and my understanding of humanity, which has been relates quite a bit to honoring the spirituality in all of us and the personhood in all of us. And you mentioned psychiatry. I'm not really a psychiatrist. I took an extra year of training in psychiatry at the end of all my other training, and to try to pull things together. But one of the things I was taught during that time by Professor Harrison Sadler, who is deceased now, but he was always talking about the structure in which we provide care, our resources in providing care. But he says it's when you go into the room together and you can sit down, you yourself and that patient, that's when you get to find out who they are as a person and what illness they might have or not have. So it's not a disease we were treating, but it was people we were treating. And I learned that very early in my training, and that has sustained me, and it's my area of interests, and it's worked.
It's like that golden moment of connection.
That's right.
And I'm not a physician. I do all the paper shuffling at the clinic, but all the work at the clinic works to support that moment of connectedness, because that's where healing takes place.
It really is. And people like Rosanna, who makes that setting possible for different people in different situations, are very important. And that's some of our weaknesses and some of our strengths of our current healthcare delivery system, is that it's just not all there for those who even want to have that moment of connectedness.
That's right. It's been my experience, and I've been with the clinic now 16 years. It was going to be a temporary job. That it's been my experience, and I'm deeply impressed by the physicians and their great desire to make that connection. Study of medicine is not an easy road, and I think Dr. Briggs was very casual about it, but so rigorous, and it requires a deep, deep dedication. And people don't go down that route unless they have a deep concern for human beings. It's been my experience that the physicians are the ones that care very deeply, and unfortunately, the turn medicine has taken in the past several years is a corporate practice of medicine that has that looks at the bottom line and ignores the true profession and the sacredness of medicine as a profession that goes back centuries.
Yes.
I think you mentioned to me that you thought there was really I guess a disjuncture between the awareness that has increased over the past years of the important role for faith and spirituality, that awareness that the individual physician may have in working with a patient, and yet the profession as a whole, or if the field is is becoming more oriented by the business model. Do you think there has been that kind of change, though, of the openness to dealing with if faith or spiritual issues for patients? Have you seen that in your own experience?
In my own experience, what I've seen is a move towards a holistic sense of the individual. Mm-hmm. There is not a separation of mind, body, or spirit. The notion of healing, which is at the center of medicine, and the notion of maintaining wellness, those aren't separated. So while the large corporate HMOs essentially look at the bottom line, I've found individual physicians embracing very actively and with deep respect the notion of their patients that beyond the physical, the totality of the humanity, as Dr. Briggs said, of their patients.
Mm-hmm. Well, healthcare work isn't easy. I wonder if any of your experience has really led you to have to deepen your spiritual life in terms of responding either to that change in the profession or to situation your patients have faced.
Well, it has, many things have changed and many things have not changed, but to harken back a little bit to the business nature of medicine, which has become increasingly complex, that it is that every profit and not-for-profit organization has to struggle daily to stay open, and many of them are skating the edge, I think would be an appropriate term. So that whether they have shareholders or don't have shareholders, they're facing similar problems. Conversely, the patients are aware that that corporate model is not serving many of their needs. I mean, it's very good if you need your arm to be set when you fall off the treehouse and break your arm. But if you have a broken heart, it may take more than that to get you there. Well, the good thing about the corporate model is they do customer surveys, and they are all quite aware that their patients are concerned about what is now called complementary medicine, of holistic medicine, not necessarily managed care organizations, but several big clinics, specifically like the Scripps Clinic in La Jolla, paying attention to dealing with the humanity of people who have had heart disease, helps them to recover in a quicker way. Therefore, it helps the budget, and it also helps the patients. Our clinic, the Scott and White Clinic, who's based in Temple, is opening up a division of complementary medicine. We don't know where it's going to go, but there are physicians who are studying all the herbs and studying acupuncture and studying, and we are working with the religious community and all these issues. Well, and we are a very secular organization, but be that as it may, these are issues that do have to be addressed, but they're not being addressed in an obvious way by the corporate structures right now because the pressure's too great.
Sounds exciting
But
to
the
talk
patients
about.
are.
Yes,
You're
the
listening
patients
to
are.
Patients
Austin
are
Faith
sensitive.
Dialogue.
Yes.
Stay tuned as we continue our discussion about healthcare and faith. Welcome back to Austin Faith Dialogue. We're talking with Rosanna Zylak, Executive Director of People's Community Clinic, and Dr. Ramby Briggs about health care and faith. Just before our break, you were talking about the ways in which medicine and even practitioners now are moving toward a more holistic perspective. Of course, we've used that word for years, and I guess now the term is more complementary medicine. But I understand that even prior to these last few years, you were part of a group of physicians who met regularly to talk about these issues. I don't know whether to talk about spirituality in your work or, you know, like you said, the whole person approach to medicine. Could you tell us a little bit about those conversations?
Well, actually, I've been a part of several groups through the years, and physicians are people just like everyone else. So one group met because there was a lot of tragedy in the lives, in our personal lives, not so much mine, but in the lives of our colleagues who had lost children and had ill spouses. This first group was actually led a great deal by the Reverend Chuck Myers, who at that time was the chaplain of St. David's, and a good friend to all of this group. But these folks were able to get together as physicians and share their grief, their understanding of suffering on their basis, and I think we always talked about those people we care for who suffer as well. And so that was very useful. We met for several years. We've kind of spread apart now, though we did get together not long after Chuck's death for a few moments to share what's going on in our lives. And so that's been very important. And there are a lot of groups that meet ad hoc to be concerned about this. Right now, there's obviously more and more interest in this community and nationwide in the concern about access to care. Mm-hmm. The organizations in their infancy, the Physicians for a National Health Plan, is growing quickly as a group. The Physicians for Social Responsibility are concerned about that, but even the main organizations like the pediatricians and the American College of Physicians are being concerned about access. They're all talking about this, which, as all movements, sooner or later, hopefully this will come together. Mm-hmm. But we have to realize that we're not doing things very well when this kind of a communication has to take place, when there's genuine concern. And I think that's there. And it depends on where people are in their lives. Physicians who are out of medical school for the first few years, nurses who are first out of nursing school, all they want to do is pay off their loans and have a roof over their head. Mm-hmm. So there takes a certain amount of time to pass for, even though those who will say they want to give back, there's some reality to that, mm-hmm. that takes a little time for folks to be able to get their act together to do that.
That's right.
You know, and to realize that there'll never be time anyway, so
That's
then
right.
they have to.
Well, now you're talking about the notion of access to health care, and that makes me think back to what you said earlier, Rosanna, about the mission of the People's Community Clinic, that, you know, everyone had a right to adequate health care. And it seems like the faith-based initiative program idea is not so practical in terms of literal medical care delivery, but that the faith community could partner with aspects of the medical community to deal with such basic questions like access to health care. Do you see any activity on the part of people of faith moving in that area with you, or would you like to enlist them as allies?
I think that change in global change or national change will require all people to begin to voice the notion that every person in this country has a right to be able to access basic health care. And the religious groups are a very potent force, and their voice raised and their understanding of the issues can go a long way to support what is already happening in the physician community.
What is going on in Austin in this area of dealing with access to health care? Is there any emerging consensus about how to deliver health care. Say, I know we've gotten better at looking at the need for children who aren't covered by medical insurance at all to receive care. And of course, there's a large or somewhat large fund now to help offset those medical costs. But what about overall? Are there any coalitions or groups who have really taken this on as a cause within our community?
To a greater or lesser degree, there's the Indigent Care Collaboration, which is working to examine ways of expanding access. What I have seen happen is that there are groups of people that are brought together, and I'm certain it's not for material gain. So then one would have to call it spiritual. I know that we are working with a very strong, committed group of people that are leaders in the Georgetown community. And they are high-profile leaders, many of them retired folks, that are very concerned because of the working poor and the low-income families living in the Georgetown area don't have access. And this is an extraordinary effort on the part of this group of citizen leaders joining together. I think that those sorts of small groups are evidence of a rising sensitivity and the need to act to create access. And it's that sort of action that creates that critical mass that causes change.
Yes. Except, and that movement is there, but it is not near enough in terms of the comprehensive need
That's right.
that this community, especially Texas and especially,
That's right.
especially us, when you look at the percentage of uninsured and the percentage of medically indigent people in this community, it's frightening.
In the Austin Travis County, more than 200. This is a very, very affluent, young community. There are more than 220,000 people that don't have health care insurance. And what does that translate to? I'm going to tell you a figure that we found stunning. We are open 5 days a week, 12 hours a day. Every appointment is filled. We did a study to take a look at the number of people requesting care that we were turning away, and we kept account for the last 2 weeks of May and the first 2 weeks of June. In 4 weeks, we turned away 1,800 requests for health care. And of that, 980 were for adults. 111 were requests for prenatal care, and the rest for children. And that's shocking.
Right. And the little clinic in Round Rock, I know forgot the name, it's the Round Rock Community Clinic, isn't it?
Yes.
Now, they're only seeing mothers and children, but astounding numbers.
Yes.
Just astounding numbers. Right across the
really
street from
reflects-
major computer factories, you know.
That really reflects this widening gap between the rich and the working poor or the indigent, which the Austin Equity Commission, I believe, is to address, that we have this gap, and it's in an affluent community. I think it's kind of an invisible gap in many ways.
Right.
I mean, we're not living cheek and jowl, as it were, with people who may be desperate for medical care. And yet I know the clinic has always been one place where people could be referred, and yet you would be one drop in the bucket, in addition, of course, to the city's clinics.
That's right. And you know, and when you said, well, how does some sense of value of spiritual or faith-based value sustain? I think in working with the clinic, and I take a look at all the people that work there, it provides one with the kind of internal support to face the enormity of the need and the insignificance of the effort, and it brings meaning to the effort. You have a greater ability to look at the glass as half full rather than half empty.
Well, of course, that's a wonderful part about being active in providing the services. At least you feel you can do something.
Yes.
You know, I think to the average lay person or person of faith, they just look at the problem and and do feel overwhelmed, do feel quite, astounded at how great the need would be. In addition to access, would there be any other specific issues that you might lift up that you hope the faith community begins to address or continues to address as we finish up here?
Well, I think we're coming also full cycle back to the time when Medicare started, where those people who are getting into the Medicare age time now, they do not have access even though they have insurance, because certain physicians and facilities will not care for them anymore, and they can't afford their medicines, which are effective but are very expensive. So we've really lost ground over the past decade in terms of health care. We have not expanded it. And this is something that, this is a societal issue. We have to hear from the community of faith, but this is a societal issue. And it is important for people of faith and for people who care about anything to be involved with this. And I think that's where our spiritual communities and our spiritual values will lead us to deal with the problems. But it's a big mountain to go over as of yet.
So not just to become aware of it when it becomes part of your own life or a loved one's life, but to realize that a sense of justice would really call for allowing people to continue to have access to very basic medicines. I mean, we're not talking about esoteric things.
No, we're talking about the most basic medicines.
I know, diabetes and heart and other...
Diabetes and heart, or things for bronchial conditions, and the everyday things that those of us that have health insurance, we take for granted that will be treated, but to think that you go to the job day after day and you're feeling half well, but you don't have a choice.
Right, and that's demoralizing, and you can't make up for that just by, saying, well, I'm going to work harder, or I'm going to feel better about myself. Well, I'm so glad that you both were willing to share your experience and your vision about health care, and I just especially want to thank you on behalf of the community for your dedication, both of you. It's been a very meaningful conversation, and I thank you very much. And thank you for joining us today on Austin Faith Dialogue.